Hey viewers, welcome to the witnessing lectures. In this video, we are going to discuss lobar pneumonia. What is lobar pneumonia? Before we define what lobar pneumonia is, let's try to define pneumonia. Pneumonia is defined as an acute inflammation of the lung parenchyma. Okay, so we are simply meaning that this is the inflammation of the lung tissue. The lung tissue can become inflamed as a result of exposure to viruses, bacteria, as well as fungal. These can inflame the lung tissue. And then what is lobar pneumonia? Lobar pneumonia, this is an acute bacterial infection of the lobe or the entire lobe of the lung, or it can also be two lobes of one or both lungs. Okay, so this is what we are talking about. Let's say this is the picture showing the respiratory tract. It's also showing the lobes of the respiratory tract. Okay, so if you look at this side, we have the right lung, then this other side we have the left lung. Okay, so from the right lung we have three lobes. Okay, so we have the upper lobe, we have the middle lobe, we also have the lower lobe. Okay, then the upper lobe and the mid lobe is separated by the horizontal fissure. Then also we have the lower lobe, which is separated by the oblique fissure. On the other side here, on the left lung, we have two lobes. We have the upper and we have the lower lobe. Okay, so we are saying lobar pneumonia, it's an acute bacterial infection. So this infection can either affect part of this lobe. We are talking about maybe part of this lobe, or it may affect these two lobes, the middle and the lower lobe. Then it may also affect probably both lobes from the right and the left lung. So that's the definition for a lobar pneumonia. So let's try to look at some of the causative organisms that causes pneumonia. Okay, so bacteria, they are the most common cause of pneumonia. Okay, so we have bacteria. Apart from bacteria, we have the viruses. We also have the fungi. Then we also have the protozoa. Okay, so among the bacteria, we have Haemophilus influenza, we have Streptococcus pneumonia, and then we also have Streptococcus agalactiae, and then also we have Staphylococcus aureus. Then we also have Klebsiella. We also have Legionella pneumophila. Okay. Then we also have viruses. Under viruses, we have the adenovirus, the influenza virus. Then under fungi, we have Pneumocystis carinii. So this is the type of fungi that causes pneumocystic gilovesi pneumonia. Normally, this type of pneumonia occurs in patients that have a compromised immunity. Then we also have the protozoa. The protozoa, we have the Mycoplasma pneumonia, which causes also pneumonia. Okay. Now, let's try to look at some of the pulmonary defenses. Okay, so these are the first line defenses which protect the lungs. Okay, so we have the pseudostratified ciliated columnar epithelium. So this is the type of epithelium which is which covers the upper respiratory tract. Okay, so this type of epithelium, it contains some cilia. Okay, so we have the cilia. These cilia, they are the ones that beat mucus upward. So in order to get rid of excess mucus, then also to get rid of any foreign substance that enters the respiratory tract. Okay, then we also have the immunoglobulin. Okay, the immunoglobulin, these are also other defenses. The type of immunoglobulin which is found in the respiratory, it's the IgA. Apart from that, we also have the goblet cells. So the goblet cells, they produce mucus. Okay, so eh, whenever there's a foreign substance or a microorganism, this microorganism will be prevented to go to settle in the lower respiratory tract, as it may stick to mucus, which the cilia may beat upward in order to get rid of extra mucus as well as the microorganism. Then we also have the cough reflex. Whenever there's any foreign substance that enters, there's a reflex action that occurs. Someone is going to cough in order to get rid of the, the microorganism. Then apart from that, we also have the alveolar macrophages. These are the permanent resident of the respiratory tract. You understand how these macrophages they do. These macrophages mostly they engulf the bacteria. Okay, so any presence of the bacteria they will engulf it. Then when that microorganism is engulfed, then it becomes a phagosome. And then the macrophages will use the lysosomes, okay, to use the lysosome to destroy this microorganism. So any foreign microorganism is destroyed. It's by the macrophages. Okay. Now let's look at some of the predisposing factors to pneumonia. Okay. The first one is inhalation of pathogens into the respiratory tract. Okay, so the pathogen, it could be the bacteria, the virus, the fungal. So this can be inhaled in form of respiratory droplet from the person who is infected. Then later they may descend into the lower respiratory tract, which may cause pneumonia. Then apart from that, also aspiration of food into the windpipe. Probably this can come as a result of regurgitation. Regurgitation, we are talking is where the content of the stomach is pushed back into the esophagus. So this can occur, and it can lead to aspiration, where the fluids of food they enter the long pipe, which is the windpipe. Later they may settle and cause pneumonia. Then also have hematogenous spread. Hematogenous, we are talking about the spread through the bloodstream. So some microorganism can gain access to the bloodstream, such as the Staphylococcus aureus. Let's say through the drug users. Drug users, they may exchange the needles. So this can transmit the infection. Okay, then apart from that, you also have prolonged exposure to cold. So that's why when it's very cold, you advise patients that have pneumonia to cover themselves. So what happens is that too much exposure to cold, it may damage the cilia. It may reduce the ability of the cilia to expel any foreign substance. That may include the microorganisms. Okay, then smoking. Okay, smoking does a lot of factors. It also changes the epithelium of the respiratory tract. Other than that, it may damage the cilia. It may also damage the macrophages. As we've just learned that these are the pulmonary defenses against invasion of microorganisms. Then other than that, we also have drugs. Okay, we have drugs like the opioid drugs, analgesics. So these drugs like morphine, they may inhibit the cough reflex. Remember, this is also one of the defense mechanisms. So if the cough reflex is inhibited, then the possibility that the microorganism may settle and invade the respiratory tract are high. Now let's look at the pathophysiology, okay, of Lobar pneumonia. Okay, so the first thing is that we are going to have this microorganism which will be inhaled. This microorganism will reach the alveoli. So upon reaching the alveoli, it's going to release the toxins. Specifically, this should be a bacteria, because bacteria, they're the ones that releases toxins. Then the virus, they will penetrate the cells. So these toxins, once they are released, they will damage the tissues. Okay. Now, in response to these damaged tissues, we have the white blood cells, which are the leukocytes. These white blood cells, they will release the leukotrienes. We have different types of leukotrienes, but in this case, it's to be the leukotriene B4, which will be released. Now, the leukotriene B4 will we will release chemicals that will recruit a number of white blood cells to a damaged tissue. Okay, so this process of chemotaxis is what is going to happen here. Right. Then apart from that, we also have the prostaglandins and other leukotrienes. Okay, I said we have different type of leukotrienes. We have the leukotriene C4, we have the D4 and the E4. Okay, so these are mediators of inflammation. So these leukotrienes, they'll bind into the endothelium of the blood vessels. So once they bind, then there will be increased capillary permeability, meaning the capillary will become highly permeable. This will lead to movement of fluid from intravascular spaces into the tissues and the alveoli. Okay, so the alveoli, they are meant for gaseous exchange. So once they have extra fluid, it's going to impair gaseous exchange. Okay, ventilation will be impaired. Then also the damaged tissue. Remember, we said that we have the toxins that we have the bacteria that will release toxins which will damage the tissues. So this also tissue damage will also activate the mast cells. Okay, these mast cells, they will produce the histamine. So these histamines, these are mediators of inflammation. They will also increase the vascular permeability. So vascular permeability, it will increase the blood flow to the area of infection. As there is increase in the blood flow to the area of infection, this also will cause a movement of white blood cells, red blood cells, proteins to this area. Okay, then there are also some white blood cells like the alveolar macrophages, which will go to the area of infection. Remember what I said? These they engulf. So they are going to engulf the bacteria, trying to destroy the bacteria. Then in this process, there will be release of cytokines, okay, such as interleukin and the TNF, which is the tumor necrotic factor. These chemicals, they are the ones that will induce pyrexia. That's why these are mediators of inflammation. So due to the inflammatory process, this will cause fever. Then remember, we talked about the leukotriene C4, D4, and E4, which are produced. So the other thing which these leukotriene they will do is that they will bind to the respiratory smooth muscles. So once they bind to those smooth muscles, then these smooth muscles, they are going to constrict. So once they constrict, this will lead to signs and symptoms such as dyspnea. Okay. Now, Lobar pneumonia is divided into 4 stages. So we have the first stage, which is called the stage of congestion. So this occurs on the first day. So under the stage of congestion, because we have a lot of fluids, okay, that will go to the affected area. Then there will be congestion within this affected area. That's why it is called a stage of congestion. Then on day 2 to day 3, the lungs will appear red. Okay, they will look like a hard like a liver. Okay, so this stage is called the red hepatization, because they're going to have a lot of the red blood cells and the neutrophils, and also desquamated epithelial cells, as well as fibrin in the lungs. Okay, so the lungs will appear red due to presence of these red blood cells. Then after that, these red blood cells, okay, because there's increased vascular permeability, which has gone to the damaged area, they'll be destroyed. So once they are destroyed, then the lung will appear gray. So this stage is called gray hepatization, which occurs on the 4th to the 6th day. Okay. Then we have the last stage, which is the final stage. Okay, so this stage is called the stage of resolution. Okay, because it involves a restoration of the pulmonary architecture. Okay, so we are talking about all those debris, what that was going on, the process of inflammation. The lungs will try to restore the whole process. Okay, so fibrinous inflammation may extend to or across the pleural space. Okay, closing lab head by auscultation. Okay, so there will be extension of inflammation across the pleural space. Okay, but at the end, this is the final stage. It is a stage of resolution. The lung will get back to its normal architecture. So those are the stages of the pathophysiology for lobar pneumonia. We've come to the end of the part A of this video. Thank you so much for watching this video. Don't forget to share, to subscribe to our YouTube channel, as well as to like our Facebook page, so that you receive a lot of updates.